Tragically, it didn't have to be this way. The lives lost, the permanent changes to people's personal health, the economic devastation, and the long months of personal sacrifice and suffering were not inevitable. Adherence to years of pandemic planning by prior administrations, decisive action, clear leadership from the Trump administration could have helped mitigate this pandemic. In fact, since the first whole of government pandemic response plan was published in 2005, the United States had ample opportunity to prepare for this type of public health crisis. Professionals across our government spent years working to improve our pandemic preparedness, from a pandemic response playbook drafted by the National Security Council in 2016, to a 2019 Department of Health and Human Services series of exercise called Crimson Contagion that simulated a highly contagious airborne influenza pandemic. In 2019, I conducted an investigation and released a report that identified the serious national security risk posed by our over-reliance on foreign manufacturers for critical drugs and medical supplies. My report found the United States was unprepared to deliver vaccinations on the scale needed during a pandemic and made critical recommendations that could help onshore manufacturing for essential supplies. Unfortunately, despite preemptive actions and warnings, the previous administration failed to take necessary steps that would have limited the impact of this coronavirus pandemic. Instead of acting swiftly and decisively, the previous administration chose to sideline our nation's foremost medical experts and failed to implement a comprehensive national strategy that left individual states to combat the virus all on their own. In fact, we know President Trump was aware of the virus, that it was both deadly and contagious as early as February 2020. However, he continued to tell the American people it would, quote, miraculously disappear, end of quote, and initially even compared the effects to the common flu, when scientific evidence clearly showed that coronavirus was much more lethal. At a time when the administration could have provided clear and consistent communication, supported scientific guidance on needed public health measures, and ramped up production of PPE and other critical medical supplies through emergency contracts and fully invoking the Defense Production Act, among other critical actions, the previous administration sought to rather downplay the virus severity to the public. On top of those failures, there have been numerous reports of widespread political interference in federal agencies' COVID-19 response, including reports that the Health and Human Services political appointees reviewed and may have altered or delayed weekly scientific reports issued by the Centers for Disease Control and Prevention about the pandemic. The Trump administration's inactions and efforts to minimize the threat posed by COVID-19 contributed to the carnage our communities have seen over the past year. Despite representing only 4% of the world's population, by January of 2021, the United States accounted for nearly a quarter of the global COVID-19 cases. There's no question that the federal government must learn from these missteps and urgently work to strengthen our pandemic response to ensure that we can both combat the ongoing pandemic and prevent the next crisis, whenever it may be, from reaching the magnitude we have seen with this one. Today, we will hear from former officials from key agencies in the federal government, all of whom are widely credited experts in their respective public health and emergency preparedness fields. I look forward to a very frank and open discussion and clear and candid recommendations about what we must do to prevent past mistakes from moving forward. It is our duty to ensure that our nation is better able to meet whatever the next crisis may be.